Hi everyone, I thought it was time to update you all again. Well, COVID-19 is now in our community and on our doorstep, and it's time to do all of the things we have been practicing for so long, properly and well. That means stay home when you are sick, get tested for COVID-19 no matter how mild your symptoms might be, wear an appropriate mask, preferably N95 or a 4-layered mask, wash your hands properly and regularly sanitize, and check in everywhere you go using the Service WA app. Get vaccinated against COVID-19 and get boosted if you have already had 2 previous doses of a COVID-19 vaccine. The COVID-19 pandemic has meant lots of changes to how we do things. It has also resulted in a large number of tasks being outsourced to the GP and a large number of patient inquiries. This has and will continue to place a strain on our team. We do ask that you show them your appreciation and respect for everything they are doing. To help us to look after you and your family and friends safely during the next stage of the pandemic, we are going to have to make some additional changes to how we do things at the Health Hub. I will try and explain these for you now. What we need you to do before the 31st of January is to download and set up the Service WA app and download and set up the AMS Connect app and link it to the Health Hub at Eaton Fair. From the 31st of January, we will be checking your vaccination status when booking your appointment with the Health Hub. Please be prepared to share your vaccination status with our team. These questions are designed to allow us to continue to see all of our patients safely, no matter their choice to vaccinate or not. It will enable us to ensure that your visit to the Health Hub is as safe as we can make it, and as safe as we can make it for those other individuals in the practice. Please work with us and not against our team. And please feel free to speak to our team about this in more detail if you have any questions. We expect that we will get even busier over the coming months, as we will be managing our normal general practice patients and tasks, our COVID positive patients, and continuing COVID-19 vaccination. To help our team manage this, we do ask that you help us by booking your appointments online and that you start getting more familiar with video appointments. Video appointments are best booked and managed through the AMS Connect app. Why video appointments? Well, we get a lot more information from a video consultation than we do from a telephone consultation. It also means less people are in the practice and in the practice waiting room, and this will help slow the spread of COVID-19. We also ask that you try e-scripts. E-scripts can be sent directly to your phone during the consultation. Talk with your GP about these at your next visit. You might be wondering how we plan on managing patients with cold and flu symptoms who need to be seen and reviewed in person. Firstly, we ask that all patients experiencing respiratory or viral symptoms, including fever, sore throat, cough, runny nose, loss of taste or smell, to be tested immediately for COVID-19. This is done at one of the COVID-19 testing centres, like the one located next to the hospital. Then, if you receive a negative result and need to be seen by your GP, we will be able to safely do so from one of our car park clinics or from our isolation room that we have created inside the practice. We remind you to please not attend the practice if you are unwell. Please get tested immediately and book a video consultation with a GP if you're seeking advice or support. You might also be wondering what you do if you catch COVID-19. We ask that you notify us when you receive a positive result by email. Please email COVIDpositive, COVIDpositive at healthhubeatonfair.com. Please send us a screenshot of your positive result in the email with your details. We will then triage your risk profile and symptoms and formulate a management plan for you. This could vary depending on your overall risk, but it could involve some gadgets to have at home to help monitor the severity of your disease, combined with regular GP or nursing reviews by video link through our AMS Connect app. We understand that this is a scary time for a lot of you, and we are ready to do what we can to help our community through this. We are here to support you and look after you. Our practitioners are all prepared for what we need to do to help you. If you are experiencing any mental health issues, please speak to someone and please speak to your GP. Please be reassured that as a practice we have tried to do whatever we can to reduce your overall risk whilst visiting us. For example, we have purchased a UVC device that will allow us to sterilise a room against COVID-19 in the case we experience an unplanned exposure or high-risk situation. This will mean that we have ways to ensure that your visit to the Health Hub is safe as possible. As COVID-19 spreads more rapidly in the community, we will want most of our appointments to be by video, where safe and where possible. However, we will continue face-to-face appointments as we understand these are very important. Should you have a face-to-face appointment after the 31st of January, we will ask that you wait in your car when you arrive and check in via the AMS Connect app. Then, when your appointment is coming up next, you will receive a text message inviting you into the practice. On checking in, we will need to scan your Service WA app, sanitise your hands, check your temperature, and ask you for any cold and flu symptoms. Please note that you must be wearing an appropriately fitted mask. You will then wait and be seen by the doctor. Upon completion of your consultation, you will then leave the practice, where within 5 to 10 minutes later you will receive a text message to complete payment for your consultation, should that apply. Thanks for listening, and we look forward to supporting you and looking after you as we move into these uncertain times.